Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing a colleague at the end of her shift. Now read the question.
OK, so the next thing is about Susie Williams in bed 3.
Right.
She's been admitted for chest pain to rule out MI. So far she had an EKG, which was OK, and the first set of cardiac enzymes and troponins are negative. When she came in, her blood pressure was elevated a little, like 182/95, but she was given losartan, and at 6 o'clock it was 142/82. She was also dehydrated, so we started her on IV fluids. D5, half normal saline, running at 125 millilitres. That can go until midnight and then it can be disconnected. She's scheduled for a stress test tomorrow and some more enzyme tests. OK?
OK.
Question 26. You hear part of a hospital management meeting where a concern is being discussed. Now read the question.
Now I'll hand over to Jenny, who has a few words to say about staffing. Jenny?
Thanks. Now, if we compare ourselves to other hospitals of the same size in other regions, we're actually recording lower rates of staff turnover. That's just as well, given the challenges filling vacant positions across the sector. Where we do compare unfavorably is in the number of days lost to sick leave. That's making it hard to maintain full cover on the wards, and we all know the costs of that. As a matter of urgency, then, HR are looking into the worst affected areas to understand the reasons behind it and to see if there's anything we can do to help and support the staff involved.
Question 27. You hear a GP and his practice nurse discussing a vaccination programme. Now read the question.
It's coming up to that time of year when we have to start preparing for the flu vaccination programme.
Yes, we usually do it at the start of next month, don't we?
That's right. If you remember last year, we hired a local hall and did as many people as we could in one afternoon.
Yes, I just started working here then. It was a hectic couple of hours, but it worked pretty well, don't you think?
Sure, but there's been so much publicity recently about how sensible it is to get the jab that I suspect we'll have a lot more people coming along this year.
So we better think about taking on an agency nurse, perhaps, to lend an extra hand.
OK, let's run that by the practice manager, and she might have some other suggestions too.
Question 28. You hear 2 hospital nurses discussing the assessment of a patient on their ward. Now read the question.
The bed manager just rang. He wants us to clear 3 spaces in the ward today.
Oh, it's never ending. Let's see what we can do.
There's no one ready to be discharged, but we could try chasing referrals for Mr. Davison to the community hospital for rehab. Where are his notes?
Yes, but has he had his assessment yet?
They were all away at that conference yesterday and the day before. I think he'll have slipped through the net.
But Dr. Amat's already got him medically stable and signed off, so he should be the next one to move on.
Well, I'd get him there as quickly as possible before they give the place to somebody else.
I'll phone them straight away.
Question 29. You hear the beginning of a training session for dental students. Now read the question.
This is session number 4, which is going to include, again, impression taking. We've created the crown impression of tooth number 30. We also took care of an inlay preparation. So today, we're going to stay on that side with our impression taking. We're going to make a duplicate of what we've already done, and our attention to detail is now going up another notch. When I take an impression of a tooth that I've created in the mouth, I naturally have to take care of the saliva, the blood, the gum tissue. We're not going to cover all that today. You'll hit that next semester. What we are going to cover are the dynamics of your impression, the margins, the proximal contacts, the bite, and the occlusion. We're going to capture all that in one impression.
Question 30. You hear two nurses discussing the treatment of a patient with a kidney infection. Now read the question.
I can't see the results of Mr. Roberts' last blood test to check creatinine levels. Did you do the last one?
No, not me. Let's see. Here it is. The last test was 4 hours ago and results show a level of 38, so it's still well below normal. We better do one when he wakes up, as it might have changed. The patient's not keen on needles, though. I had a real job last night trying to convince him it was necessary. Not the easiest of patients, if you're happy to have a go.
OK, my turn, I reckon.
That is the end of Part B. Now look at Part